I was a master surgeon in my past life. They called me the national medical saint. This interview today, I've got this in the bag.
I am sorry.
So what if I'm a saint? Now that I've crossed over, I can't even find a job. And this body has appendicitis.
Sir. Are you okay, sir? Sir. I'm sorry, our surgeon passed out from exhaustion, but we'll get you a better, more experienced doctor to do your surgery.
Can you hurry up? I am already anesthetized. Everyone else gets a cheat. Why do I only get appendicitis?
MedMaster System experience 0. MedMaster System abilities none. Daily check-in not done missions. Available missions 1.
System body may be late, but he never misses out. My cheat code! It is finally here!
MedMaster System host, would you like to check in?
Check in.
Location impact factor 0. No bonus. Random reward acquired. Master level per stream. Suturing. MedMaster System.
Just a starter reward, and I've mastered fine tissue suturing. That is over a decade of skill.
MedMaster System.
Accept starter. Mission.
Congrats, host starter mission accepted. Mission requirement. Perform your own appendectomy. Mission reward. Starter pack S1. Master level appendectomy. Main quest. MedMaster System. Main quest. When the host becomes a doctor. When the host becomes a doctor, reach deputy chief level. Unlock hidden surgical specialty. MedMaster System. Main quest. When the host becomes a doctor and reaches deputy chief level. Hidden surgical
Unlock
specialty.
hidden surgical specialty. Could it be the brainstem danger zone? I can't even pass a hospital interview. And I am supposed to be a deputy chief. Isn't that a pipe dream?
There has been a major crash on Eastgate Avenue. The hospital has no extra doctors, but I've already asked my supervisor. I'm afraid you'll have to wait a little longer.
If no one's doing it, I'll do it myself.
Don't be ridiculous. My God, this incision, it is impossibly perfect.
Mirror, hold it for me.
Okay, here.
Nurse, Lucy, I am here for the surgery. What have I seen? The patient is operating on himself.
You don't just stand there. Help me.
Okay.
Massive car crash. The scene is just so horrific. It is just so terrifying. Where is he? He just had his appendix out. How did he get out of bed?
They're short-staffed. They're even using interns. If I join in, I might save a life or two. I am a licensed doctor. In an emergency like this, it is not against the rules. If I do well, maybe I can get a job here.
What is the patient's status?
Massive bleeding from a crash. We've applied pressure.
Heart rate and pulse pressure.
Heart rate is 137. Blood pressure 70/50. 20-point difference.
Classic case of shock. If we don't act fast, he could die at any moment.
Quick, to the AI.
Random mission activated. Mission objective, crash rescue. Mission reward, based on rescue procedure rating, success rate, and number of lives saved. You'll receive a generous reward. During this random mission, experience points are double.
Quick, 2 liters of Ringus, low molecular weight, dextran, 200 milligrams every 10 minutes. Push the DS pen.
He's awake.
Get Anne all ready. Prep for surgery.
Rescue rating. S line saved 1.
Alex, no way. He just had surgery. How is he in the ER? Hello? Okay. It really is Alex. He not only operated on himself for an appendectomy, but he is up and about right after surgery.
What is Alex Carter doing here? Forget that he failed the interview. This guy, didn't he just have appendicitis surgery? Alex Carter.
Dean Hale.
Great stitching. Who knew Dr. Walker had this kind of skill?
I stitched it myself.
You did this yourself.
Dr. Carter, the patient's stable. We saved him.
Good.
He is one of the ER's top attending physicians. One rescue, and this arrogant attending is now a fan of Alex's. You just got out of surgery, and you came right here.
Yes.
How many rescues have you been in?
7. And I saved them all.
No wonder this rescue wasn't so stressful. It is because we had a beast like Alex Carter, who just pulled off 7 critical rescues. Dr. Carter, yesterday I was wrong about you. On behalf of the hospital, I am offering you a position. I hope to work with you.
This doctor, so skilled and in complete control, was rejected just yesterday.
Dean Hale. Looking forward to it.
Dean Hale, he really operated on himself. And right after surgery, he went to save people. He saved 10 people. A guy like that was rejected by our hospital.
I'll say no more. Let's watch the video.
He found it blindly, ectopic appendix. Wow, his knowledge of anatomy is just insane. This surgery is a work of art. This video is definitely worthy of being a teaching video. Amazing. Dr. Carter, welcome to Bayview General Ear. Dr. Carter, your skills are incredible, so I couldn't be much help. Sorry about that.
It is fine. Without you, I wouldn't have gotten to lead the surgery.
So, Dr. Carter, tonight, let's work the shift together.
What shift? He just got out of surgery. He needs to rest for at least a few days.
Damn.
He just had an appendectomy with his abdomen stitched up. He still wouldn't ignore the injured. A doctor with such integrity is becoming so rare these days. Back to your room. Get some rest. Then you can return.
Dr. Carter, you just had surgery and then went to save someone else. He's all over the hospital. You are a big celebrity now. So many girls are fighting to get your appointments. He's absent. This wound is healing so well. Oh, and itch or uniform and badge are all ready. Once you are healed, you can start any time.
Okay.
Nurse Lucy. Even in her loose-fitting scrubs, she can't hide that amazing figure. Time for today's check-in. That mission 3 days ago. My success rate was 100%. So I got a rare high-difficulty surgery. Master level lower limb skeletal reconstruction. Time for today's check-in.
Checking location. Location impact factor 1.3. Impact factor 1.3. Bonus reward. Slice boost. Med system. Location impact factor 1.3. Random reward obtained. Bonus reward. Slice boost. Random reward obtained. Complete location impact factor 1.3. Reward. Perfect level manual hemostasis.
Perfect level manual hemostasis. This is my first perfect level reward. But manual hemostasis, it has been obsolete for ages. The only time it is useful is for pre-hospital care. Perfect level manual hemostasis. It is on a whole other level. I can use my sense of touch to locate bleeding points. I can easily stop bleeding points that are impossible to find. This is basically a human hemostatic agent.
Ready? Ready.
Dr. Carter, would you mind if your girlfriend had a scar on her stomach?
Don't worry. I'll stitch it up as neatly as I can. There won't be a scar.
You are truly Bayview General Star Doctor. So skilled and so gentle.
Let's begin.
Was the anesthesia not enough?
I am a little excited.
This girl, is she a little masochistic?
Opening the abdomen. Forceps. It is done.
It is over 10 minutes and 21 seconds. Dr. Carter, you've set a new record for ER appendectomies.
This flawless surgery. Was Alex really rejected by so many hospitals? With skills like that, I am not even worthy to carry his shoes. As an attending physician, I can't possibly assign a resident like Alex to do menial tasks. Just being qualified to assist him is an honor.
That car crash. A director's daughter. She has a severe leg fracture. The hospital is contacting a skeletal reconstruction expert to discuss reattachment. I should hurry over and check it out.
Congratulations, you've met master system and acute appendectomy. Rating S. You've earned 30 experience points. You've gained an additional 3%. Master level appendectomy proficiency.
Once proficiency reaches 100%, will it automatically upgrade to perfect level appendectomy? My experience is already at 90%. Just one more surgery, and I can draw a prize. I wonder what kind of reward I'll get.
After all this discussion, the best option now is amputation.
Can't you reattach her leg?
For limb reattachment, the optimal window is 6 to 8 hours. Also, the severed limb must be preserved in excellent condition.
But your daughter's left leg is beyond reattachment.
Mr. Grant, we've already 3D printed a titanium alloy prosthesis. Dr. Linwood, is there anything you can do?
Dr. Linwood, can my daughter get a prosthesis?
The risk is very high.
Very high risk.
Mr. Grant, since you are one of us, I'll be blunt. Titanium alloy reconstruction. Here, the technology isn't mature. Your daughter's leg has been like this for too long, and the outlook isn't good. For a prosthetic reconstruction now, the success rate, there is no precedent here. Amputation is the only option.
Dr. Linwood is a top orthopedic surgeon, especially for lower limbs. He is one of the best. If he says it is impossible, it is like a death sentence. It is over. My daughter.
No. There is still a chance for skeletal reconstruction.
What nonsense are you talking? Dr. Linwood already said. It is impossible. What makes you think there is still a chance?
Ridiculous. Do you even know what orthopedics is?
Dean Hale, your hospital's young doctor's professionalism needs improvement. Sophia? Honey, what is wrong?
30 pulse. She's cold. Bradycardic. She's going into shock. Massive bleeding.
Wait!
Her toes are losing blood flow. We have to amputate now.
What? Mr. Grant, there was a chance before, but now it is showing signs of necrosis. Reconstructing the femur is impossible.
Can't dance anymore. He said he could rebuild my bone.
Asking my daughter to accept this tragedy is already so cruel. This doctor is just going to cause her more emotional pain.
Hey, we'll stop bleeding! But we still can't find the source!
Let me in. Just a small-town top-tier hospital. The chief is just this good. Perfect chance to show my expertise. The wound is badly damaged. You couldn't stop the bleeding. That is understandable.
It won't stop!
It won't stop. Amputate now. It is not just about her leg anymore. If we don't amputate, to stop the bleeding for good, your daughter will die.
No more waiting. I have to do this, no matter what. Perfect level manual hemostasis.
Son of a bitch! QPP, it is stable! What?
Dr. Linwood, don't touch her.
Dad, I want him to do the surgery.
I don't know how this young doctor stopped the bleeding with his bare hands. But stopping bleeding and bone reconstruction are on completely different levels of difficulty. It is not impossible. I can consider bone reconstruction. But if it fails, we'll amputate immediately. But then, the amputation will be more extensive. And the surgery will be more expensive.
Sophia.
Okay, I am willing to take the risk. Dr. Carter, will I be okay? Will I be able to dance again?
Get some rest. When you have a show, I'll come watch you dance.
I'll dance my best. I'll be waiting for you.
She is fully anesthetized. The prosthetic is here. We're ready to start.
Let's begin. He used his bare hands to stop the bleeding. How on earth did he do that? It is like magic. Forget it. He must have just gotten lucky. But this ultra-difficult prosthetic reconstruction, only I can do it. The patient wants Alex to do it, as if I'd agree. She is out. So I'll have to step in to boost the success rate. You really know this surgery. Alex is so in sync. He is not blocking my view at all. Such perfect teamwork. My regular chief surgeons can't do this. Alex's timing is on par with mine, or even better. You've done bone reconstruction before. You can do it.
I've mastered skeletal reconstruction to reach master level worldwide. There aren't many. Your technique looks a little green to me.
Pre-op, we expected to remove 13 centimeters. But now it is much worse. We'll have to remove at least 19 centimeters. With such extensive removal, amputation is safer. The posterior tibial artery. How did it get here?
The patient's condition was left untreated for too long. The tibial artery retracted into the leg bone. Several segments of the artery are completely embedded in the bone.
In this case, reconstruction is impossible. We have to amputate. Abandon the reconstruction.
Dr. Linwood, can I have one last try?
Yeah?
I just need 5 minutes.
5 minutes? Huh. Fine. I'll give you 5 minutes. 5 minutes won't hurt. Worst case, it is still an amputation. Let this mysterious young man show his stuff.
Like this, right? That is it. Steady.
He did it.
Not bad.
I am a top expert, and a 20-something resident is praising me and teaching me how to stop bleeding.
This doctor in the ER, what a waste. With a genius like that, they still complain about being short-staffed and ask us for people.
I don't know.
Actually, I personally recruited Dr. Carter.
The top expert I hired is an assistant, and the resident is the lead surgeon. Dr. Linwood, you... What?
Mr. Grant, he is better than me, please. Be quiet. Don't disturb us.
These bastards. They took advantage of my absence to plan this, so the resident takes the fall. What a flawless surgery. Even I, an outsider, can tell. This young man, he is the real deal.
Mr. Grant, look, if you don't mind, could you step aside?
Quiet.
Don't disturb Dr. Carter.
Mr. Grant is an outsider. He is taking up a prime spot and wasting our chance to learn. The toes are warming up. The blood flow is restored.
Dr. Carter's suturing is incredible. That leg looks just like it was before.
It is done. Take the patient out.
Young man, so young and so experienced. You are truly remarkable. You are sure to become a world-renowned expert.
Providing patients with the best care is what we're supposed to do.
Here. This is my card. Keep it.
That is Mr. Grant's personal card. One surgery and Dr. Carter is set for life.
I am going to see my daughter.
Dr. Carter, we're currently tackling some frontiers in skeletal reconstruction. If you are interested, you can join our research team. The budget is up to you.
Dr. Linwood, right. In front of me, you are trying to poach him.
How is that poaching? I just appreciate talent.
Have you considered heading your own skeletal reconstruction division?
No, thank you, Dean Hale. I'd rather stay in the ER. Master level skeletal reconstruction is just the start of my career. Here in the ER, I can treat all kinds of patients.
In that case, you can stay in the ER. If you are unhappy with anything, just let me know.
Dr. Carter, a true prodigy. Come visit our department sometime.
They're already trying to poach him, and you are joining in. Dr. Carter already said he wants to stay in the ER.
Dean, Chiefs, I have to go review the surgical report. I'll be going now.
Go ahead.
Congratulations, you've completed a 3D printed cervical bone titanium alloy reconstruction. Operation grade S. Congratulations. Experience gained, multiplied by 50. You've gained master level skeletal reconstruction. Proficiency increased by 3%. You can draw a prize.
Draw a prize.
Drawing prize. Congratulations. You've gained master level manual dexterity.
Master level manual dexterity. Before, I only dared to cut small blood vessels in the fingers. Now, my hands can reach into the brain, navigating between nerve fibers and brain matter without a single tremor. This ability is insane.
You know, Dr. Linwood, right? In skeletal reconstruction. He is a top expert. But I am not here to praise him. I am talking about our own Dr. Carter. The surgery Dr. Linwood couldn't do. Our Dr. Carter could. Who in this hospital hasn't heard? I heard the patient. 3 days after surgery, their leg function test was better than patients who'd been recovering for 2 weeks. I also heard he is a new hire this year. He was actually rejected at first. Luckily, our vice dean saw his potential.
Dr. Carter got rejected. Then who replaced him? What kind of genius? They must have been parachuted in to be a chief or deputy chief, right?
I am the doctor they hired in that interview. Parachuted in. What a joke. Forget being the lead surgeon. Even getting on the operating table depends on the nurses and the attending's mood. The gap between people. How can it be so huge?
About Dr. Carter from the ER. Have you heard? Don't get discouraged. You were an undergrad with 2 second author sci papers, and you trained at Hopkins. Your potential is higher than his. Besides, we in neurosurgery can do ER work. But can an ER doctor do our work? One wrong cut, and the brain's nerves are all mashed.
Okay, Chief, I'll go change the dressings.
How about this? This afternoon, I have a surgery. You come with me. You'll get some experience.
Okay, thank you for the opportunity, Chief. Alright, I'm off.
Dr. Carter, I'm here to check out.
Just go to the nurse's station. That is it. I've already signed your discharge papers.
I just wanted to say goodbye. Dr. Carter, look. Dr. Carter, thank you so much. My wound has been itchy and sore, but just thinking of you. Dr. Carter, can I get your number?
Everyone, I've got a tough case. Come take a look.
Isn't it obvious? A herniated disc? Frank, are you getting worse at this?
Exactly. Just send him to spine surgery. It is not some rare condition.
The patient is only 21. A herniated disc. That is way too young. Besides, he is almost paralyzed from the waist down.
What?
Dr. Carter, well, I'll let you get back to work.
He is too young. A herniated disc. There must be another cause. Does he have a history of spinal trauma?
Right, he said. He was street racing 7 or 8 years ago and got into a car accident. He broke 2 cervical vertebrae.
And this X-ray is too low. It should be higher to include the entire spine.
Okay, I'll go check again.
If I am right, the paralysis is probably from those vertebrae. Besides, from my recent check-ins, I've gotten some great rewards. Expert level nasal hemangioma removal, master level intestinal fistula dilation, and a lucky draw gave me master level intramedullary tumor resection. If it is really a spinal issue, then this patient's life is already half saved.
Amazing! It is incredible, Dr. Carter. The scan was just 1 vertebra short of capturing the lesion, and yet it was still missed.
It is really like that. Dr. Carter, that is some truly terrifying clinical intuition.
Dr. Walker! Dr. Walker! Does my son have a tumor? Please, you have to save him. He is our only son.
Dr. Carter, this is the patient. Ryan Young, he is only 21.
Dr. Carter, please! Save our only son!
Please, get up, please. Stand up.
Get up! Get up!
A spinal tumor, that is spine surgery and neurosurgery specialty. You can ask Dr. Carter to save him, but removing a spinal tumor, he is helpless there, too.
Basically, it is confirmed to be a tumor. Get an MRI. Also, get a lumbar, puncture, biopsy to identify the tumor.
Thank you. Doctor, thank you, doctor!
Dr. Carter, should we transfer him to neurosurgery?
No need. Let's first see the tumor's type and grade.
Okay.
The tumor is benign, but the location is tricky. It is unfortunately attached to the brainstem. This makes the surgery's risk skyrocket.
Hello?
Yes. This is radiology. We called earlier. You have a patient there with a high cervical ependymoma. Yes. Our chief has reviewed the scans. We discussed it at noon. The tumor's location is very tricky. Surgery is extremely high risk. We recommend conservative treatment. That way, at least the patient can live longer.
Okay.
Even with my master-level spinal tumor resection, operating near the brainstem is like playing with fire.
You heard what they said, and I also recommend conservative treatment.
Doctor, will this affect his ability to have children?
From what we can see, the tumor isn't pressing on the nerves for sexual function. It won't affect his fertility.
Doctor, I want the surgery. I can't be a cripple. I can't be a cripple.
Ryan, listen to me. The doctor just said it is very risky. Anyway, it won't get any bigger. Worst case, we can just lose the leg. Then your sister can take care of you.
Mom, I can't be a burden. I can't burden my sister. I can't hold her back. Mom, I can't hold her back.
Don't move too much. If the tumor shifts, I can't guarantee which nerves it might press on.
Okay, Ryan, I promise. We'll have the surgery. I promise.
Alex, this, you can do it.
I can.
I thought a 20-something resident doing skeletal reconstruction was already amazing. And now he is saying he can do spinal cord resection. This surgery, I can't do it. If you are really confident, I can vouch for you. But I have to bring in a neurosurgery chief to oversee it.
No problem.
Was he just waiting to die? Or had he already known the surgery would work?
Chief Shaw, the ER asked you for a consult.
They have a patient who needs surgery. It is probably related to our neurosurgery department. They want me to oversee it. What? Not interested. I hear the surgeon today is that legendary Dr. Carter. Come on, you've been feeling insecure, right? Today I'll take you to see our neurosurgery department. It is one of the hospital's most advanced departments. You were selected to be here, which proves you are no worse than that, Dr. Carter.
Thanks, Chief Shaw.
That's all.
Let's begin.
Alex's hands under the microscope at 8 times 10 magnification. They're completely still. Such rock-solid technique. Is this really a resident? How is this possible?
This is a C4 to C6 tumor. Spinal tumor. Resection.
Dr. Carter's cutting the dura, and from the back of the dura he makes a midline incision. And just like that, the tumor is fully exposed. Perfect.
Steady. His hands are so steady. He didn't even touch the surrounding delicate tissue. He is using the aspirator perfectly. 2, he is controlling the suction with pinpoint precision. Not a single drop is left behind.
Weren't we here to find fault?
Sama, you don't copy his technique.
Great. He finally found the flaw.
His approach is way too reckless. If you copy him without his skill, you are just pushing the patient towards death.
So this is what the deputy chief meant. But he is right. He is absolutely right.
Imitate him, and the patient dies. Try to be like him, and you'll probably get killed by the patient's family. A talent like this. I've never seen anything like it.
Tumor with a cyst.
The cyst's pus just sprayed out. Oh no. This is a spinal tumor. During resection, this is an unavoidable accident. No matter how skilled you are, there is nothing you can do. The field is obscured. There is no way to continue the surgery. Dr. Carter, stop the dissection. Or else, you'll cause even more severe spinal damage.
Chief, he is still dissecting.
With the naked eye? But this is microsurgery.
It is out.
How did he do that? With almost no visibility, he still operated.
My previous opinion was so narrow-minded. Alex, though he is an ear doctor, he is a natural for neurosurgery. He is a genius. A man like him. One day, he might even tackle the brainstem danger zone.
Doctor, my son!
Don't worry. The surgery went well.
That is wonderful. Thank you, Doctor.
Chief Shaw, What brings you here?
I am here for the surgical record, Dr. Carter, about that surgical record. Do you still need it? If you don't, well, could I have it? I'd like to take it back to neurosurgery for a teaching case.
Of course. It is all yours.
Thank you, Dr. Carter. From now on, feel free to stop by neurosurgery anytime. And if you have time, you can also join our teaching conferences.
Sure. I'll definitely come by.
Great. I'll get going then.
Okay, take care. Okay.
Feel free to stop by anytime. Dr. Carter, you are incredible. Chief Shaw is known around here for being a total snob, and you got him to come here himself to ask for your record. Badass. You are a total badass. Come on.
Dr. Carter, someone from Medical Par is looking for you. They said it is good news.
Good news? What good news? Do you know what it is?
I heard it is about Sophia Grant in the VIP suite.
Donation.
You guessed it. It is a donation. So, the money officially, it is for our heir. But everyone knows Mr. Grant is donating. All because of that surgery you did.
D. Mr. Grant.
Dr. Carter. Our heir is full of talents like Dr. Carter. For our people, for the public. They've sacrificed so much. And so, I am donating to our RR because of our RR doctor's dedication and compassion. Dean Hale, I hope RR will train more talents like Dr. Carter.
Mr. Grant, it is just what we do as doctors.
Good. Heroes are made young.
Hello?
Is this Dr. Carter?
Speaking.
This is HR from the hospital. I tried calling you earlier, but your line was busy, so I called your department's landline.
Since I got back from the meeting, several department chiefs have been trying to recruit me. The phone hasn't stopped ringing.
What can I do for you?
Here is the thing. We've just been informed that the hospital has decided to adjust your salary. It is being raised to the $500,000 bracket. We'll send you the details to your phone shortly. If you have any questions, feel free to contact us.
Okay.
$500,000 a year. No more worrying about rent. I think I've finally settled in Bayview City.
Daily check-in.
Check-in complete at Bayview General Hospital. Influence factor 3.6. Check-in reward. Moderate bonus applied. MedMaster system. You've gained perfect level vascular palpation.
Perfect level vascular palpation.
MedMaster system.
So I am basically a human ultrasound.
This is a severe pneumonia patient. He has been bedridden for a week. Let me ask you all, for a patient like this, what is the biggest concern?
Pulmonary embolism.
Right? It is pulmonary embolism, especially for patients who are elderly and bedridden. Always remind them to get up and move around. Otherwise, they're prone to pulmonary embolism. The mortality rate for pulmonary embolism is between 90% and 100%. In as little as 15 minutes, the patient is gone. Before, I've seen 6 patients with pulmonary embolism, and none of them survived.
How are you feeling?
Doctor, my leg, suddenly it had a sharp pain.
And now, how are you feeling now?
Now, I feel like someone's pressing on my chest.
Is your chest hurting?
No.
Is it hard to breathe?
No.
Something like that, you have to be very careful. It could be a pulmonary embolism. All right, let's go.
Blood pressure. 80/60. Jugular vein distension. Mild edema in the left leg.
Is he kidding? Feeling for blood pressure? You think you are a blood pressure monitor. Take his BP.
(81/62).
He must have guessed.
That is incredible. Sir, your family. What are your financial means? Do you want the expensive medication or the cheaper one?
Young man, just give me the best medication. My insurance covers 95%.
All right. Then RT-PA.
Prepare RT-Pay. Now? Okay. Activate the chest pain emergency protocol. Okay. Be careful. Don't move the patient. Oh. Oh. Pulmonary embolism. Code blue. Give him RTPA, subcutaneous, low molecular weight, heparin, quick! RTPA thrombolysis, heparin, anticoagulation. For over 30 years, this is how I've always done it. But with 6 pulmonary embolism patients, not a single one survived.
Chief Warren, his blood pressure's back.
Congratulations, Chief Warren. You saved a patient with a pulmonary embolism. Dr. Carter, I am just not good enough. He is alive! High risk, acute pulmonary embolism. In less than a minute, he was saved.
As long as he's alive.
So, has the departments scheduled you for clinic hours yet?
In a top-tier hospital, clinic hours are usually for chiefs and deputy chiefs. As a resident, I am nowhere near qualified to see patients alone.
Can you see patients?
Of course.
Good. This afternoon, you'll be in clinic. I'll have Dr. Walker show you around. How about that?
Okay.
Chief Warren is giving me special treatment. For a regular doctor to get this far, it could take 10 years. But since I started here, it has only been 10 days. I am getting closer to becoming a deputy chief.
Doctor, it hurts.
So this is what it is like to be a handsome doctor.
Where does it hurt?
Lower abdomen.
Any other symptoms besides the pain?
I've been bleeding for about 3 days.
Do you usually get menstrual cramps? When was your last period? When was it?
I never get cramps. It hasn't come this month.
Lie down. I'll examine you. Point to it. Where does it hurt the most?
Here.
Right? Here? Does this hurt? How about this? A little? That hurts. Okay. You can sit up. Are you sexually active?
I am a freshman.
Go get an HCG test and an ultrasound.
Doctor, I am not pregnant. My stomach just hurts. Can't you just give me some painkillers?
Go get the tests.
Dr. Carter is incredible. His interview flow is so smooth. His judgment is so seasoned. He makes it look so easy. Is he really just a resident? Even a senior attending isn't this good.
Doctor, please take a look.
Ectopic pregnancy. That is what is commonly called an ectopic.
How is that possible then? Doctor, can you perform the surgery?
You don't need surgery for this. It is not a severe ectopic. We can treat it conservatively. I'll transfer you to Obgyn.
No. I want to stay with you.
Alright. I'll prescribe methotrexate. If it works, you won't need surgery. Go get admitted.
Chief, I am not qualified to evaluate Dr. Carter.
Dr. Walker, you need to grow a spine. From now on, all of Dr. Carter's cases are your responsibility. Any problem?
No problem.
And I thought that with Dr. Carter here, my workload would lighten. I just pass all the trouble on to him. But now, my status has just taken another hit. And Dr. Carter, the nurses adore him. The patients are all over him. His status is skyrocketing.
Something's wrong.
It hurts! Dr. Walker!
Not good. It is a ruptured ectopic pregnancy. Massive bleeding. Check pulse, respirations, and blood pressure. Start 2 IV lines. Go get the attending. Quick!
Doctor?
Dr. Carter, it is Rachel Roy, ruptured ectopic pregnancy. Massive bleeding. We've stabilized her. Good.
I'm an attending. Why am I reporting to a resident? And so naturally.
Rachel Roy, the ectopic pregnancy.
Yes, this is the room.
Okay. Send her to OB-GYN. I'll schedule surgery ASAP.
Okay.
Can I take over this patient?
Are you kidding? You are from the ER. If the ER wants to do it, I suppose it is possible. You are Dr. Carter.
That is me.
Nice to meet you. I am Dr. Lee from OB-GYN, but our department does laparoscopic surgery. It is a new procedure. In our whole department, only 4 or 5 people are proficient.
No problem.
Okay.
Then I'll go talk to OB-GYN and coordinate.
Okay.
Complete a minimally invasive surgery. Reward, master level interventional experience.
Looks like the surgery. I have no choice but to do it.
Girls, Dr. Carter is coming tomorrow to do surgery in our department. Whether we can keep him is up to you.
Dr. Carter. Oh my god. OB-GYN tonight is turning into a spider's web. We're gonna reel him in. And OB-GYN, one big family.
I heard several departments tried to recruit Dr. Carter, but all failed. This time, OB-GYN has to land him.
Check incomplete at Bayview General. Impact factor 4.0 and Warner Master System. Reward value quadrupled. Congratulations, you've obtained Master level Master System.
Medmaster System.
There are always others who are better. The debridement step can be this perfect. Master. It seems I am still far from being a master. So far.
Dr. Carter, we're ready. Shall we begin?
Yes. Is that Dr. Carter?
She is waking up from anesthesia. Is Dr. Carter really that handsome?
Cold. Dr. Carter, I am a little cold.
Let's begin.
So dark. There is some serious adhesion and a chocolate cyst.
My God, he found the ectopic pregnancy. How long was that? Less than 10 minutes. He is from the air? You sure he is not secretly sneaking into OB-GYN to practice laparoscopy? Dr. Carter! Dr. Carter! I am on my knees!
Prepare to extract the embryo.
The chief did this! Dr. Carter is incredible! Such precise technique! I thought the chief was doing it!
It is done.
Only 37 minutes! The standard time for this surgery is 2 hours. Even I need an hour and a half. To finish this in half an hour. What kind of monster is he? Dr. Carter, please stay for a moment. The chief wants to see you.
Ectopic pregnancy, laparoscopic master system complete. Grade up. Experience gained 30. Mission complete. Obtained master level interventional experience.
Now, even if I had to do neurovascular interventions, it'd be a piece of cake.
Chief, Dr. Carter's waiting for you in the office.
Is the chief out of surgery? We have to keep Alex here.
Hey, kid. Take a look at this. What does this message mean?
Dr. Lee told Dr. Carter to talk to the chief. Chief, you have to keep Dr. Carter.
You young people, just to keep a pretty boy, you are dragging me, a woman past her prime, into this. That Emily. What a fool. Emily, you are just in time. You can explain to me what this is about me, talking to Dr. Carter.
Chief, you'll definitely want to talk to him.
Nonsense. He is a resident. Me, talk to him. He is handsome, but don't think I'll help you keep him.
Chief, he did a laparoscopic surgery in just 37 minutes.
What did you say? Even I would take at least 50 minutes to finish. The surgery's already done? What? The surgery's already done? And I thought they hadn't even started yet. Good call. In the conference room. I am on my way.
I told you, the chief would want to talk to him.
Alex, I see you don't have any publications. The ER is so busy. You have no time to write papers. How about this? Come to our OBN department. I guarantee you'll have 2 papers published in a year. How about it?
Chief, right now, I am not planning to switch departments.
That is a real shame. No rush. Residents have a 3-year rotation plan. Residents rotate through pediatrics, obstetrics, infectious diseases, and hand and foot surgery, and other departments. Once Alex's AR rotation is over, sooner or later, it'll be our OBN department's turn to have Alex.
I am the one who saved her, honestly. I should get at least a little credit, right?
Dr. Carter, I am about to be discharged. Don't you have anything to say to me?
Get well soon.
That is it. Dr. Carter, do you know, when I was bleeding out, I was in so much pain. I thought I'd die. In my haze, I felt someone pounding my chest. It felt like my bones were breaking. And all I could think about was you. I thought, I have to hold on until you could operate on me.
I thought to save you, but all you could think of was another man. Talk about torture.
Good looks and a healing touch. Dr. Carter, you are a total heartbreaker. Why are you hiding this away?
It is from a patient. I should put it away.
All right. Put it away.
It may sound a little suggestive, but this is a clear boost to my bonus. Why would I turn it down?
Welcome to Bayview General. Check-in complete. Your impact factor is 4.6. Medium bonus applied. Reward multiplier, 4.6x. Congratulations, you've obtained the master level gastric perforation surgery package. Simple suture, repair, and subtotal gastrectomy.
Doctor, please save my grandpa.
What is wrong with him?
About 2 or 3 days ago, my grandpa suddenly got a stomachache. He thought he could tough it out, so he didn't go to the hospital. But now the pain is much worse.
Have you seen a doctor or taken any medicine?
He did. He took some kind of painkiller and some stomach medicine.
Okay. Any pain in your feet?
Yes, you are really good.
You don't have to talk. It is okay.
Burning pain. Severe abdominal pain, nausea, vomiting. He has a fever too. Plus, he is toxic. He could go into shock. Gastric perforation.
Get an abdominal x-ray also. CBC, COGS, liver and kidney function. Do them all.
Okay. Thank you, doctor. I'll take my grandpa now.
Okay. There is a wheelchair over there.
Thanks, doctor.
Next.
Doctor, look.
Gastric perforation. He needs to be admitted. We need to schedule surgery ASAP.
Okay, whatever you say. I'll go now and get my grandpa admitted. Okay, thank you, doctor.
For this case, I suggest a subtotal gastrectomy. He has multiple perforations. If we try to suture them, there are too many to handle. And it is a complicated procedure. I am afraid he won't last that long.
Right. This patient is in his 70s or 80s at that age. Let's just do the subtotal gastrectomy.
Simple suture repair is also an option. Simple suture repair. It is a viable option.
What is your take?
Actually, the patient's condition isn't as bad as we thought. During my exam, aside from his high blood pressure, he is otherwise healthy. If we do a partial gastrectomy, it will severely impact his quality of life afterwards. For the patient, that is unacceptable. So I recommend simple suture repair.
Repairing it is too difficult. Just the perforations on the scan are 7 or 8. Unless the surgery can be done in 40 minutes.
Impossible. Once we open him up, it'll only get more complicated. There could be many we can't see, small perforations.
I'll do this surgery.
You? The ER called us for a consult because they couldn't handle it and needed our expertise. We specialize in digestive diseases. Even our deputy chief can't handle it. And Alex can.
I know you are great at orthopedics, and you are good with minimally invasive procedures. But gastrointestinal surgery is different from other specialties. How about this? I'll do the surgery, and you can watch and learn.
Okay.
Okay, I trust Dr. Carter. Whatever Dr. Carter says.
Alright, so the plan is set.
Thank you.
Get ready as soon as possible. Once you are ready, I'll start the surgery right away.
Wait, isn't Dr. Carter doing the surgery?
I am the deputy chief of GI surgery. This surgery, I've done at least 100 of them. Don't worry.
The surgeon who operated on himself, Alex Carter, young doctor, masters complex skeletal reconstruction. Heirs Alex Carter scores again, 37 minutes, to master laparoscopic surgery.
Can we have Dr. Carter do the surgery?
I am a deputy chief, and I am being rejected. And the one taking my surgery is just a lowlier resident.
Fine. You want Dr. Carter to lead. Then it is his.
Anyway, I'll be in the OR. When Alex messes up, I'll just step in and save the day.
Dr. Alex Carter, the ER star. I've heard so much about you.
He operated on his own appendix, and then did his own bone reconstruction, laparoscopic surgery. So amazing.
Finally seen him in person. Yeah, so young and handsome.
No wonder patients all want Dr. Carter to do the surgery.
Let's discuss the plan.
The surgery includes an exploratory laparotomy, bowel obstruction, decompression, and suturing the perforation. The challenges of this surgery are clear to everyone. It is a complex procedure. We have to finish it in 40 minutes. Let's prep for surgery.
Retractor! How is this? Surgeon! Am I in your way?
He is a deputy chief for a reason. As an assistant, he is much more efficient than Dr. Walker.
One pole of this retractor. That is backed by over 20 years of clinical experience.
Done.
28 minutes.
28 minutes! In under half an hour! Dr. Carter, that was incredible! So amazing! The whole surgery was like watching art! I can't even put into words how shocked I am! Deputy Chief! We want to learn this too!
I want to learn it too.
Look at the group chat. Dr. Carter. He did it again. A high difficulty surgery. I heard. The deputy chief of G surgery thought his surgery was tough. Dr. Carter finished it in half an hour. He is only 24. He is a real genius. My God. Dr. Carter's surgeries. If I could master just one, it would set me up for life. And us. We're just here to make up the numbers. Back to the grind.
I was the top of my class. That is why I was hired. I have several side papers, strong in research and clinical skills. But after joining the hospital, I am just a resident. Dr. Carter has such a thin resume, but he is the hospital's star. When will I escape this miserable resident life?
David. The pleural fluid from bed 7, take it to the lab. Oh, and Chief Stone wants you to finish those charts. Before lunch, put them on his desk.
Okay.
My talent shouldn't go to waste.
Chief, please, just give me a chance to prove myself.
It is about Dr. Carter, isn't it?
He is just from some no-name school. How is that fair? I refuse to believe I am worse than him.
All right. Perfect timing. There is a patient in the ER who needs our department for a consult. You are coming with me. How about it?
Thank you for this chance, Chief.
I'll make the most of this chance. Time to soar.
This patient is complicated. From another hospital, suspected lung cancer abscess. He is infected, but they haven't identified the bacteria. Stick with me. You'll learn something.
Okay.
Male patient, 63 years old. Right-sided chest pain for over 10 days. Cough and sputum for 2 days. Admitted the day before yesterday.
Everyone, I think it is more likely Streptococcus constellatus with an anaerobic infection. Switch to high-dose penicillin plus metronidazole. That should be more effective.
Like, the patient has multiple bullous cavities, not just a cavity. That means high tension. The outer walls are thick and smooth. There is compressive atelectasis. There is a fluid level in the lesion on the same side. There are patchy infiltrates. This presentation is more consistent with a polymicrobial infection.
Wow, this resident is trying to show me up.
I rushed to lab before I got here. I had them run a pus analysis, a culture, and a sensitivity test. I think the results should be ready by now.
Stop wasting our resources, rushing a case like this. Am I even getting a lunch break?
What is the report?
From what the lab tech said, it is probably not bacterial.
The report, it says, no, Streptococcus.
His gums are swollen. There is pus in the periodontal pockets. Trichomonas vaginalis.
Alex, stop joking around. He is a male patient. He is in his 60s. If you are going to make stuff up, at least Make it plausible.
This is a serious consultation. We're not here for your nonsense.
It must be a rare pathogen. Let's just use broad-spectrum antibiotics. Meeting adjourned.
This is Chief Stone from Pulmonary Surgery. He has treated respiratory diseases for over 30 years. He is an expert at handling all kinds of difficult infections.
Before, I've seen a similar case, but it was after a craniotomy for a brain hemorrhage. Extremely dangerous. This case. The priority now is to save his life. David, start the quadruple antibiotics. It is just a tricky case, as if I need Alex telling me what to do. Trichomonas vaginalis. Please. What a ridiculous guess.
Let's go. How are you today?
Chief Stone, you are absolutely amazing. My husband, his fever's gone. And today, he can even talk to me. When my husband gets out, we're going to give you a banner for your miracle work.
Oh, no need. It is all part of the job. We'll just observe him for a few more days. And he'll be good to go.
Thank you. Thank you. In just a few days, he'll be home.
My God, he's burning up. That is a dangerously high fever. Get Chief Stone now. Right away.
What is going on? Why did it come back? Start the polymyxin.
Yes, Chief Stone. Polymyxin. It is pulmonary surgery's last resort. It has to work. He's crashing.
Chief Stone, bed 60. The patient's fever is spiking again, and the room is covered in sputum and vomit and excrement. He is not getting any better. What should we do?
Enough. You can go now. I'll call my mentor. Dr. Linwood, I have a case. I need your help with... Dr. Linwood, what do you suggest?
It is probably a superbug. Use a broad-spectrum antibiotic plus albumin and gamma globulin to cover all the pathogens and boost passive immunity.
Okay, I'll go tell the family about the new plan. Goodbye, Dr. Linwood.
The hospital has prescribed a brand new treatment plan.
How much will this treatment cost?
Not much. One course is about $1,000.
$1,000? That is enough for my husband and me to live on for months.
Are you sure you want to stop treatment? Listen, his condition is still very critical. If this works, it should be a permanent fix.
We can't afford to try again.
Honey.
What do I do?
What a shame. Such a rare case. If we tried a few more treatments and a few more courses, maybe I could have published a new paper.
Hello?
Bed 60. The patient with a recurring lung infection. He is suddenly asking to be discharged.
He has recovered that quickly.
His condition was never under control, and it kept flaring up. Each time, it was severe. and the costs kept rising. Are they using him as a guinea pig?
Ma'am, are you checking out?
Yes. My husband's condition isn't improving. We can't afford it anymore.
If he really leaves the hospital, if he'll even make it 3 days, is anyone's guess.
Ma'am, before you leave, let's try one last treatment. It is free. What do you say?
All right, let's try.
Can you come here? We need a sample from bed 60.
Dr. Carter, this patient. Are you sure you want the gel agglutination test? That is for testing vaginal secretions for trichomonas. But he is a man. What are we testing for?
Please. That is the test.
Okay. Dr. Carter, 3 plus signs. Strongly positive.
Ma'am, this time, it is right.
Oh, say that to take our money. I am never trusting you again.
Ma'am, this treatment will cost around $300. I'll pay. If it doesn't work, it is free. What do you say?
I was so harsh to him. And this young man, he is handling my anger so gracefully. I don't know why. But this young doctor seems so trustworthy. All right.
About the patient from bed 60, how are they doing?
Let me check. Chief, that patient should have been discharged by now.
What is going on?
Chief, the patient in bed 60 not only hasn't been discharged, but they also scrapped our entire treatment plan and started a new one. Now, the patient's condition has improved. They're doing much better.
How is that possible? Who prescribed the new plan?
It was Dr. Alex Carter, and the new diagnosis is Trichomonas vaginalis.
How is that possible? It is really that. This is insane. Professor, about the patient I told you about. The other day, now the diagnosis is Trichomonas vaginalis. Yes, one of our residents used metronidazole and a herbal remedy. He prescribed herba agramoniae, radix sulphurate dichloroot, Omphalia mushroom, Sichuan pepper, quisqualis fruit, pulsatilla root, philodendron bark, betel nut, artemisia, and cnidium, boiled into a decoction.
A resident at your hospital. Is that creative?
Professor, that doctor, he is not your average resident. He is in a league of his own.
Don't just because he gets the rare infection, you overestimate him. Charlie, I taught you to be down to earth.
Professor, I've always remembered that he also performed a skeletal reconstruction. That surgery, even Dr. Linwood, the expert, was stumped.
You call that a resident?
David, don't get ahead of yourself. Just focus on being a resident.
He figured it out a week ago, the real cause. But I and the entire department were blinded by our arrogance. We almost killed them. And now, I look like a fool.
You'll never guess. That patient from bed 60 just got discharged. He even gave Dr. Carter a plaque and a $100 red envelope.
But that envelope, Dr. Carter didn't accept it. Dr. Carter has such great ethics, so handsome. But this time, I was really blown away.
Trichomonas can enter the respiratory tract through the mouth and hence on the bronchial walls, causing obstructive necrosis. I can't help but wonder what state of mind Dr. Carter was in when he made that diagnosis.
Dr. Carter's skills are incredible. Seriously.
Congratulations, you've completed a difficult case. Difficulty, B treatment, C experience X10. Current experience, 100%. You've earned a lucky draw.
So it is not just surgery, diagnosing a tough case, and when the patient recovers, also gives me experience points. Lucky draw.
Reward obtained. Master level flap grafting.
What are you waiting for? Compressions and ventilation. Forget the rest. What is the patient's status?
There was a factory accident. The boss was pushing them to meet a deadline. Someone nodded off. Improper operation. The machine hit a power line, a high voltage line. 5 people below were all hit. They collapsed on the spot.
Electrocution.
Dr. Carter, what do we do now? This patient is dying.
Dr. Carter, the veins, they're all blocked. I can't find a place to get the needle in. If we don't do something now, the patient will be dead in hours.
Not me.
Dr. Carter is so reliable, just 2 words. And I am filled with hope.
He did it! Dr. Carter did it! He got the IV in on the first try.
Prep for surgery.
Dr. Carter is a god. His skills are even more insane than the rumors. Debridement. Such a basic procedure. And he makes it look perfect.
Crank up the oxygen to 5 liters. Push the fluids.
On it, Dr. Carter.
Call ICU. Get them up there now. They might need ECMO.
Great work, Dr. Carter. We'll take it from here. If it weren't for Alex tonight in the GR, someone really could have died.
Alex, have a seat.
Chief Warren.
I heard about last night. You did a great job. The 4 patients are all out of danger. One had an amputation, but they're stable. The biggest problem now is the one in the ICU.
That patient. I was the one who saved him. Did something go wrong?
Is he not going to make it?
You did an excellent job. The patient has no major infection. The problem is him. If the area of necrosis and the infection were just a bit worse, he'd have no choice but to amputate.
But
now, he wants to save his right hand. But saving it is too costly. He does want to save his limb, but a limb salvage surgery is extremely difficult. In our burn surgery department, there are very few doctors who are confident they can do this. Plus, the patient's family is very difficult. If the surgery fails, the doctor will face endless medical disputes.
That is true, but I've already mastered master level flap grafting. This ICU patient's limb salvage surgery is exactly a flap graft. By taking from one area to repair another, I can restore the patient's arm function and appearance.
Chief Warren, I'd like to try the limb salvage surgery.
You've studied burn surgery?
Well, I had a breakthrough the other day.
You are kidding me. But this patient, I've already sent him to the nearby International Friendship Hospital. There's a burn surgery expert visiting. He agreed to do the surgery for me. Want to come with me? It'll be an eye-opener. You'll learn a lot. He is a top-tier burn surgery expert. Normally, you only see him in textbooks.
Sure.
Since you are interested in burn surgery, watching this will be good for your career, but I should warn you. This expert has a unique style. Try not to be too surprised.
Okay, let's go.
No wonder. He looks so familiar. He is from the latest edition of the burn emergency textbook. He is one of the editors. Now, just waiting for the surgery to start.
Alex!
That is our class rep from college. Leo.
It really is you. How'd you get in here? This surgery. Are you here to observe? Just a heads up. Dr. Monroe has a temper. When we get in there, just stay in the corner. If you can't see, don't try. Just lay low and you'll be fine. Thanks. No problem. Besides, as residents, we have no rights anyway. We gotta look out for each other. But for this chance, I had to beg the chief for ages. It is brutal. Whatever. That is life as a resident. Let's go. So that is what you meant. It wasn't solidarity. It was pity.
Let's begin. This patient's debridement. Who performed it?
Dr. Monroe, before the patient arrived. The debridement was already done.
Dr. Monroe, it was one of our residents. It was him, Alex Carter.
A resident. Back in the day, even attending's debridement got them ripped apart by Dr. Monroe. But a resident's debridement actually impressed Dr. Monroe. Impressive.
Not bad. Come up front.
My classmate, a resident, is getting special treatment we never get.
What a nimble Z-rotation technique! And the triangular scar contracture correction. So masterful. No wonder it is Dr. Monroe's technique. We're witnessing the pioneer himself.
Dr. Monroe's surgery was brilliant. Even with my master level flap grafting, I can't find much fault.
What? Do you have a better idea?
Just as I thought, Alex must have done something to upset Dr. Monroe. He has already made him angry.
Dr. Monroe, he didn't mean anything by it.
Quiet. You were frowning. Is there something you think I did wrong?
The flap's off by a bit. If it is placed like this, closing the wound will create too much tension.
But I tested this. This angle is just right. The deep fascia of the right upper limb, it'll compress when suturing, causing the flap to shift.
Yes.
You've got potential. What is your name?
Alex Carter.
Come over here. He'll be my first assistant.
I am still watching from outside. How did Alex get next to Dr. Monroe? And he even pushed aside the burn surgery chief.
A resident! From Bayview General, a resident. How are we supposed to compete?
convex lens.
This surgery was even harder than I thought. Last night I already did a surgery on the fly. Today, I am really starting to feel the strain. This kid, could he do it? What am I thinking? The next surgery is because no one else can do it. If a resident can do it, then all the burn surgery chiefs, deputies here, might as well have wasted their lives.
Let's continue.
His heart rate is spiking. His temperature is rising too. If we can't figure out what is wrong, we'll have to abandon saving the limb and end the surgery.
Heart rate's at 170.
What?
Bleeding. Why is he bleeding?
Dr. Monroe, did you use too much epinephrine?
No. You're asking about epinephrine?
To keep the surgical field bloodless. Yes, used epinephrine to stop the bleeding. Could it be the epinephrine?
His oxygen saturation is dropping.
This...
Anesthesiologist, check the airway.
He is suffocating. The hemorrhage is causing pink frothy sputum. That will eventually lead to airway obstruction.
In this situation, if we don't act fast, it won't just be about losing a hand. He might not make it off the table.
Lungs. Pulmonary embolism. Quick. Get cardiology. Stat.
We don't have time. By the time cardiology gets here, he'll be dead. Scrub, nurse, ultrasound gel.
You can do this. You are gambling with your career. Are you kidding me? You are just a resident without waiting for cardiology. You are going to do this. PE surgery. Do you have any idea what this means? This will end your medical career.
Dr. Monroe, I am Dr. Peter Warren from Bayview General. I vouch for him.
Peter Warren, is he the one? The pillar of emergency medicine, especially critical respiratory cases. That Peter Warren? Yes.
You vouch for him. You won't do it yourself. And make a junior take the fall. Just save him already.
Dr. Monroe, you are overestimating me. In my 30-plus years, I've lost 6 pulmonary embolism patients. My success rate, 0%. The only one I saved was just a week ago. Alex saved him. Apply the gel. I'll assist. You are in charge.
Got it.
Turn off the nitrous oxide. Give 100% oxygen. Put him in a semi-upright position. Insert a catheter. Give 20 milligrams of furosemide. 8 milligrams of dexamethasone. 100 milligrams of hydrocortisone.
This kid, he might actually be good.
What are you waiting for? Dr. Carter's in charge.
Yes.
Regional wall motion is reduced. Ejection fraction is 20%. Cardiogenic pulmonary edema with pulmonary embolism.
Get a TD stat PD. APD. Give urokinase and heparin. 500 mcg of digoxy injection. IV push.
Yes.
Stabilized. Systolic pressure is holding around 100.
Dopamine per kilogram per minute. 7 mcg. Systolic pressure. Dopamine, switch to dopamine. Drop the dose to 5 mcg.
Dr. Carter, let me wipe your brow.
Great. He is saved. This Dr. Carter. He must be a top cardiologist. Prompt. Dr. Monroe, we can continue the surgery.
Due to this emergency, the rest of the surgery must be done in half an hour. Next, we have to perform the most critical part, the double pedicle flap graft. Dr. Monroe's condition. I am afraid he can't go on.
Half an hour. Who can do this surgery?
I am not fast enough. At least an hour. In this field, I am afraid only a top expert like you could be that fast.
Earlier, you said you could do it if I give you this surgery. How long will it take?
20 minutes.
Are you kidding me? Honestly, he is so fearless. Even if I recovered and did it myself, I could only finish in half an hour. Looks like I have no choice but to take a chance. Alex, you are up.
Okay.
Surgery's over. 18 minutes. He really did it in 20 minutes. The suturing, the graft. This kid!
Dr. Carter stepped up in a crisis and still performed so brilliantly. What nerve. His skills are incredible.
Yeah.
My God, he is a legend.
Without Alex today, this surgery would have likely failed. A 20-something resident. How could his skills be so advanced?
Dr. Monroe, that is far enough. It is getting late. Go get some rest. We should be going. 2.
Thanks for everything.
Let's go. Let's go. Look at them. They're all lying in like wolves. If we're slow, who knows? They might try to poach him. Hurry. Hurry. Go, go, go. But, now.
If I could have a student like him, I'd have no regrets.
Dr. Monroe, let's go.
All right.
Alex Carter. Alex Carter. I remember now. Dr. Carter. I think he applied here.
What? Why'd he end up at Bayview General?
We rejected him.
What? HR actually rejected a talent like him? Go pull up Alex Carter's resume. I want to see it myself.
He is from regular university. Just a bachelor's. He hasn't published a single paper.
So a genius's resume looks like this.
We have a classmate of his here, Leo Jacobs.
That clumsy guy who can't get anything done right. So I was wrong. Clumsy Leo is the real standard for a resident from a regular school.
Chief.
Alex, I am starting to think I'll never figure you out. I am taking you out to dinner tonight. Do me the honor.
Sure. Good thing I am not on call tonight.
Great. I'll wait for you at the entrance.
Okay.
Nice one, Dr. Carter. Our Chief Warren, he is a total henpecked husband. His wife is always worried that he'll be seduced by a flirty nurse, a pretty farmer rep, or even a young female student. So, Chief Warren never eats out with anyone. For him to ask you out, our Chief Warren must have really changed his tune.
Heard you went to watch Dr. Monroe's surgery. How was it? Scary, huh?
It was terrifying.
Right. If I hadn't been there, the patient almost died.
All right, I am off. Then. Is that you from International Friendship Hospital, my old classmate? The deputy chief. Why the late call? What is up? How can I help you?
About your Dr. Alex Carter. What is the deal with him?
Alex Carter.
He just left for the day. What is this about?
Were you a Special Forces soldier? How are you so calm?
What is going on?
You haven't heard? You know Dr. Benjamin Monroe, right? Dr. Monroe messed up a surgery. No one could take over. Then your Dr. Alex Carter. He stepped in and finished the surgery. And he did it better than Dr. Monroe.
Did you guys hear that? I just asked Alex if he was scared by Dr. Monroe's surgery. Me? What a joke.
Oh my God. This is so insane. Is he hacking? Dr. Linwood and Dr. Monroe.
Right.
Alex is really going to kick the nation's top experts and crush all the pioneers.
Alex doing something like this. Isn't that normal?
What is this about leaving? I am not leaving. Time to grind. Or I'll be worse than a resident. I wanna cry.
Grind. Grind now.
Back to the grind. Let's grind. Chief Warren, thanks for dinner. I brought you a specialty from my hometown.
You are too kind. You really don't have to be so formal. This young doctor, not only is he a skilled surgeon, but his demeanor is also impeccable. Very impressive. Alex, I believe you are still an undergrad, right?
Yes. I wasn't focused on my degree. I was just focused on surgery.
No wonder your clinical experience is so solid. A young doctor as exceptional as him. Wherever he goes, he'll be a hot commodity. Have you thought about pursuing a higher degree?
My degree will definitely affect my promotion. If I get a master's, becoming a deputy chief should be faster.
I plan to get a master's.
Great. Then I'll formally introduce myself. I graduated from Concordia University, Capital City. I am currently chief of the ER at Bayview General Hospital, professor at Bayview University School of Medicine, a PhD supervisor, a member of the National Medical Association's Lung Cancer Research Group, and deputy chair of the Pulmonary Embolism Research Society.
Chief Warren, right now, I'm considered a social examinee. So for the recommendation road, it is a bit tricky.
Don't worry about that. I'll figure something out. Bayview University has its own admission standards. We have that authority. If you are not confident, I can talk to the school and lower your interview cutoff by 100 points or so.
Lower the cutoff, just to admit me. Chief Warren's expression, he doesn't seem to be joking. But I am taking the exam mainly to see if I can break the record. To make up for my last life's exam when I lost over 20 points. A perfect score is my goal.
Chief Warren, no need to lower the cutoff for me. I'll be fine.
Good. Then I wish you good luck on your exam. Let's go eat.
This intern is so pretty. She's definitely going to be a top-tier doctor.
Great! I am finally interning at the Bayview General. Alex! I am here.
Were you a patient of Dr. Carter's?
Lucy, it is me. I am a med student too. I am a 5th-year intern.
You are the one. Go to exam room 7 and shadow Dr. Carter.
Oh my god. My dream came true. Thanks, Lucy. Dr. Carter, I am the intern shadowing you today.
Oh, it is you. How is your wound healing?
All healed. Dr. Carter, look. There's not a single trace.
Do you know what you'll be doing here?
Putting down disposable sheets for patients, positioning them, and preparing everything you need for your exams.
Go get the next patient.
Patient 7, you can come in now.
What is bothering you?
Doctor, I've had a cough for days. I've tried several bottles of cough syrup. It is not working, and my chest hurts too. I took my temperature before I came. 100.8 degrees.
Open your shirt. Let me listen.
Okay.
In the past month, have you had a cold?
No.
When did the cough start?
It has only gotten worse in the last 2 days. The medicine didn't help.
It got worse. So you had it before?
Yeah. Just a cough here and there. For years.
I'll order a chest CT and a sputum culture.
Okay.
Dr. Carter, I almost fell for his story. So, he has had a cough for a long time.
Patients will often overlook many issues. As doctors, we have to analyze what they're really saying.
I get it.
Go, get the next one.
Patches, nodules, strands. This looks like tuberculosis, but not typical. Let's wait for the sputum culture results.
Okay.
Hello?
Dr. Carter, about the patient. His TB test was negative, but we can't rule it out. In clinical practice, only about 20% of TB patients test positive.
Okay, got it? Your condition is still unclear. Recommend a bronchoscopy.
Sure, no problem. As long as you cure my illness.
Who knew? An intern can be useful.
Dr. Carter, what is wrong?
Nothing. Next patient, please.
Look, Doc, are you any good or not? If you can't handle this, I am flying to Capital City to see a specialist.
Linear infection. Have you ever been injured?
How did you know? A few years back, I was at a BBQ with friends, got drunk, and got into a fight with the table next to us. Those guys, no, all of them.
BBQ, bambos, skewer.
Get a contrast chest CT and a 3D reconstruction. It is pricey. Is that okay?
Of course. Whatever you say, I've got the money.
You're amazing, Dr. Carter. Whatever test you ask for, he just agrees. He doesn't object at all.
Looks like this girl has no idea how much of a knockout she is.
Go get the next patient.
Doctor, what is that?
Your cough. Did it start after your last fight?
I think so. I can't really remember.
This, if I am not mistaken, it is a barbecue skewer.
During the fight, someone was stabbing with a skewer. But it can't be a skewer. Something this long, stuck inside me. How could I not know?
Your insides aren't like your skin. They have very few sensory fibers. So stabbing or cutting, you barely feel. You must have been drinking a lot. You were very drunk. So when the skewer went in, you felt nothing. Then during the fight, the whole skewer went right in. When you woke up, all that was left was a tiny hole. Once you were sober, you couldn't feel it.
So, doctor, what do I do?
The only option now is open heart surgery. If we don't remove it, the inflammation will persist. After repeated infections, it could lead to sepsis. That will cause right heart failure, and you'll lose your chance for surgery.
Doctor, I'll have the surgery. Please, save me.
I heard Dr. Carter saw a patient today with a skewer in his lung. Just one patient. Such a tricky case. And he diagnosed it the same day.
There was a patient a while back with a similar case. They treated him for TB for 3 years. Turns out he had a fishbone in his lung. They never found it. In the end, it led to right heart failure. He was too late for surgery. He just waited to die.
Alex is going to be my student. He is brilliant. He makes me look good. But who is going to do the surgery? The skewer has gone through most of his lung, and it has pierced the left pulmonary artery. When we remove it, he could bleed out. Then the rest will be even harder. The difficulty of this surgery and the risk are off the charts. Amber, I have to report this now.
Check incomplete at Bayview General Hospital. Impact factor 5.3. Medium reward bonus applied. Reward value 5.3. Congratulations. You've acquired master level superconductive visual bronchoscope intervention.
I already had master level intervention experience. Now, my understanding of interventional procedures has taken a huge leap. This procedure is perfect for minimally invasive foreign body removal. Looks like the bamboo man surgeon is set.
How are you feeling?
Doctor, don't make such a big deal. I am feeling great. In 3 days, you are even holding a hospital-wide conference. You guys are really...
Valium, anti-shock, meds, and hemostatic, now.
We can't wait 3 days. Call an emergency hospital. Wide conference, now.
We can't wait any longer. But the bamboo has shifted. If we don't remove it now, it is a ticking time bomb.
After all these years as chief, I wouldn't dare operate.
How could it be? And just happens to be able to do this surgery. Unbelievable.
No need for open chest. This patient can have a superconductive visual bronchoscopic intervention.
Minimally invasive. It is too hard. Even with open chest surgery, stopping a massive bleed is already hard. With a tiny incision, you can't stop the bleeding.
This surgery, I'll do it.
Dr. Carter, don't push it. Interventional and cardiology both said no. It is their specialty. We're in the ER. We shouldn't interfere.
This surgery. The ER is taking it. If anything goes wrong, I am responsible.
Dr. Walker.
Alex, are you sure you don't need cardio, interventional, and pulmonary for joint surgery?
No need. This surgery, I am completely confident.
Okay, I trust you. I have a surgery this afternoon. You can call in the deputies yourself. Looking forward to good news.
With my master level interventional skills, plus my master level superconductive visual bronchoscopic intervention, if anyone else helps, even one more person, my success rate will drop a notch.
Who is Alex Carter? You are Alex Carter.
Yes.
You are way too young. How can I trust my brother with you? You think just because my brother has a Pikachu tattoo, he is an easy target. You are using him for practice, right? Get someone else? You have to get someone else?
Just a moment. I'll get the chief.
Dr. Warren, Dr. Hale, they're both in surgery. Looks like I'll have to call Chief Stone.
Chief Stone, could you come down here?
Hello? I'm Chief Stone. I'll be assisting with this surgery.
You've got the look of experience. All right.
Alex, Dr. Warren is staking his career on you. If anything goes wrong with this surgery, Dr. Warren is basically out of medicine.
$10,000 IU heparin. Through the carotid sheath. Intracoronary. 200 mcg nitroglycerin.
You are going to first occlude the pulmonary artery and then operate. This surgery is extremely time sensitive. More than 3 hours, and the risk of infection could double. Superconductive catheter intervention is already time consuming, and Alex is adding a stent and a closure procedure. Can he really pull this off? What? This is insane, that guide wire. How is it so obedient?
Superconductive retrieval.
Dr. Carter, the lead surgeon, is so calm, not a drop of sweat, but Chief Stone, his assistant, looks like a rookie in comparison. He is way too tense, right? They found a foreign body.
Forceps.
Alex's hands, cutting the bamboo stick. So steady. If it were me, the first cut, the stick would have shifted. Done. It is done. A nearly 8-centimeter foreign body. And it pierced the lung. He actually retrieved it with an intervention. I never knew that was possible. This is incredible. That was nearly perfect technique. Alex, why don't you come work with me? I'll get you a patent. And I'll put you in charge of cardiothoracic superconductive intervention.
No, thank you, Chief Stone. This is just a side project.
This is just a side project.
Mission complete. MedMaster System. Superconductive visual bronchoscope. Interventional procedure. Operation grade. S reward. 45 experience points. Bonus reward. Superconductive retrieval proficiency. MedMaster System. Plus 3%. Next draw. 95 100ths.
Great! Just one more surgery, and I can draw again. With my increased proficiency, my understanding of the superconductive retrieval has improved a bit more. If I get to perform it again, I can shave off a few more minutes. I can get the time down to under 40 minutes.
Doctor, how is he? My brother's not dead, is he?
The surgery was a success. He is in the ICU. He'll be there for a day or two. Then he can move to a regular ward.
Good thing I insisted on you. If it had been that young doctor, who knows what would have happened to my brother? He died. Right on the table. He'd be a goner.
You were a lifesaver. This surgery, even in the state, hardly anyone can do it. I wasn't the lead surgeon. It was the young doctor who just left.
That guy. He is not even younger than me, is he? He has got more wrinkles than me. He is that good.
One hour and 5 minutes. Not bad. Where is Alex? Which or is he in?
One moment, Chief. Let me check. He has no surgeries today.
Strange. Could it be he is in the cardiac surgery? Or I'll go check.
Chief, I found it.
Which or?
He finished the surgery 10 minutes ago.
50 minutes. Such a short surgery, unless there was an accident. Could it be that halfway through the surgery, the patient bled out, and he had to abort?
Chief, surgery wasn't a failure. He is in the ICU for monitoring. Would you like to see the procedure?
I feel like, at this rate, I am not even worthy to be his mentor.
Dr. Carter is an asset to the whole hospital. I hope all departments can share him.
I still suggest, Dr. Carter, stay in the ER and specialize.
All right, everyone, calm down. I have an announcement. This announcement is about a statewide selection of doctors under 30 for an elite team to compete in the UF's National Elite Scalpel Challenge.
This is perfect for our Dr. Carter. The winner gets a huge reward, and their hospital gets free. Tens of millions in medical equipment. The problem is the timing. It conflicts with his postgrad exams.
If Dr. Carter participates, he is sure to break our hospital's history of coming up empty. If it is not possible, the competition is every 3 years. Let Dr. Carter wait until he is 27.
Let's send it to Dr. Carter first.
Let him get prepared.
Okay.
Thanks, Doctor.
Statewide selection, and it is on the same days as my postgrad exams. But if I can finish the exam in an hour and then rush over, I'll have plenty of time. Winning the National Elite Scalpel Challenge means I can apply for a research grant worth hundreds of millions, and I'll get access to national level labs. This will bring me one step closer to becoming a deputy chief. Forget it. For the next few months, I'll focus on building my team.
The State Elite Scalpel Challenge. The bar for this is so high, Dr. Carter, you are entering.
Yeah.
Dr. Carter, you'll definitely do great.
I'll be the lead surgeon. I'll be the lead. And I'll just need a few doctors under 30 who are in one piece. Can eat when hungry and drink when thirsty. That should do it. Next patient, please.
Dr. Carter, just out of surgery.
Yeah.
You must be tired.
Congratulations, you've won Master Level Radiation Targeting Experience.
This isn't surgery. It's a skill every oncologist dreams of. Targeting. Chief Warren, from oncology, the radiation plan's not yet implemented. Could you send me a few to look at?
Sure. I'll send them over.
Dr. Carter, here are the treatment plans from oncology.
That was fast. Do you have the charts? It is okay if you don't.
I do. I'll go get them. Okay.
This radiation plan can be reduced by a third. Here, the radiation field is too large. This area is unnecessary. This is an unnecessary radiation field.
Wow. Dr. Carter is amazing.
He even knows radiation targeting. Even oncology needs his help. He is incredible. I have to get this over there. I can't delay the patient's treatment.
Isn't this the plan your ER asked for? Why are you bringing it back? And with all this scribble...
How dare he? How dare he call Dr. Carter's work scribble? Wait a minute, oncology attending. Just an attending. And he dares to disrespect Dr. Carter.
Young lady, I am the one who sent this over. And now, you are bringing it back. Alex Carter's edits. Why is your ER meddling in our oncology business? Alex Carter should be asking me for advice. Come on, hand it over. Let me take a look at his targeting.
Dr. Mann, that won't be necessary.
What are you all discussing?
Chief Hughes, this is Dr. Carter's revised plan. Please take a look.
Since it is Dr. Carter's revised plan, I'd better take a good look. Let's see if Dr. Carter has a knack for being a chemo doctor.
These are the 3 patients scheduled for chemo today.
Come on, let's see. Let's see what the ER genius is made of.
Contact radiation oncology now. Postpone today's chemo for the 3 patients. Follow Dr. Carter's instructions and revise the plan.
Okay.
This was all done in just 10 minutes, these revisions. Oh, right. Chloe, could you give Dr. Carter a message for me?
Of course, Chief Hughes.
Ask Dr. Carter if he has the time to give our oncology team a lecture. How does that sound?
Sure, I'll be sure to tell him. Well, Chief Hughes, I'll get going.
Got it? I'll go when I have time.
Dr. Carter, you are amazing. I'll definitely learn from you.
How is your wound healing? Don't take it off. I am not looking.
Is Dr. Carter getting shy? It is healing great. There's no scar at all. You can't even tell I had an appendectomy.
This girl, does she really not see me as her mentor and a man?
Dr. Carter, you are here.
So much tragedy in my family. My husband and my oldest son, they both died in car crashes. My oldest daughter-in-law ran off with another man. My other daughter-in-law took the kids and went back to her family. And now my second son is in this state. What have I done to deserve this?
We'll do everything we can. Please, wait outside.
Patient info, Paul Simmons, male, 43. Half an hour ago, he suddenly passed out, lost control of his car, and crashed. The cause of his unconsciousness is unclear, but his vitals at the scene were normal. His pupils are equal and round. Light reflexes are reactive. His mother says he has a history of hypertension. His brother's death was caused by hypertension, induced stroke, in a car crash.
Co-radiology. Order a head CT. Get consent from the family. Issue a critical notice. When we're done, take him straight to radiology. Okay. Also, start an IV.
Okay, on it.
Get him on the monitor. Check his glucose.
Glucose is 5.7. BP is 172/96. MHG. It is from his hypertension. A brain hemorrhage.
From my exam, it doesn't seem like a hypertensive event.
CBC, liver, and kidney function.
Number, not a drug overdose either. Wait for the CT. With my skills, I am actually stumped.
His kidneys are smaller than average. Creatinine is 365. It is hypertensive nephropathy. But that shouldn't cause a coma. If we can't find the real cause, it is like a ticking time bomb inside him. Sinus tachycardia, not a brain or heart attack. But we can't rule them out either.
Please, save my son. What is wrong with him? What tests do we need? We'll do them all. Money is no object.
To be completely sure, we'd have to wait 24 hours for another head CT. Or an MRI. Do it.
Let's do the MRI.
MRI takes half an hour. It is torturous for most people. Given his condition, the risk is extremely high.
Then what should we do?
I'll go check on him.
Chief Warren, the patient is bleeding profusely from his nose.
My son!
High blood pressure, kidney dysfunction, shock hepatitis, high white blood cell count, low platelets, mild anemia. What on earth is this? Go get the ICU doctor. If we have to, we'll transfer him there. In the ICU, they have all the life support equipment. As long as you can pay, even if the heart and lungs fail, they can use ECMO and other machines to keep him alive for weeks or even months.
I've ruled out everything I can think of. Hard to say. Let's get him to the ICU. At least he'll be stable. We can run tests there.
All right. We'll need the family's consent.
We'll sign anything to save him.
He broke a bone. My God, those nurses, they broke the patient's bone.
His condition was already poor, and now a broken bone.
My son!
I am so sorry. He is a bit older, so he is prone to osteoporosis. So when moving him, accidents can happen. Don't worry, I'll get an orthopedic surgeon. The treatment costs. It is on us.
Oh dear, Allah! This is all karma.
This isn't right. What is going on?
My dear, get up, get up, get up.
Get up, ma'am, get up.
No, I see you. I am taking my son home.
Wait. Ma'am, he's going home. In his condition, he won't last a week.
Right.
This is the karma we deserve, son. Where'd you go?
Morning, Dr. Walker. By the way, about Paul Simmons. How is he doing?
Oh, him. He is about to be discharged.
You found the cause that fast?
Not at all. His mom didn't want treatment. She gave up on him. She even signed the consent form. But then, our nurses, while moving him, broke his arm. So Chief Hale, afraid of a lawsuit, so he forced him to stay for the fracture.
A fracture? A man in his 40s? Breaks a bone just from being moved. That doesn't add up. Didn't his mother say she'd pay any price for treatment? How did her attitude change so fast?
I was on the night shift last night, and I heard two nurses talking. That is how I found out. Let's just say, it serves them, right?
What happened?
His dad was a doctor, too, but he ran an illegal clinic. His racket was strictly forbidden, gender testing, and he also offered patients medical abortions, surgical abortions, and other services. Let me tell you, the number of baby girls they aborted each year was at least 200 or 300. Even just to make that money, his dad would deliberately misidentify male fetuses as female. Until one time, a pregnant woman threatened to kill herself if she couldn't have her baby. It was a boy. That is when it all came out.
She seems like a decent woman. How could she be involved in something like that?
You have no idea.
Man, has his vision gotten worse lately? Man, lately, has his vision gotten worse?
My son has said several times that he can't see clearly. He wanted glasses. Right then, I thought he was karma. How does a man in his 40s suddenly become nearsighted?
Vision loss, even blindness, is also a symptom of a neurological disorder.
You ordered a serum chemistry panel and a bone marrow biopsy. You suspect he has a multiple myeloma?
Right? Just wait for the results.
If it is really this disease, then it is truly karma. It is a rare disease. It is called the bone-eating disease. In my 30-plus years of practice, I've only seen one case. It is almost untreatable. Unbelievable. It is really a blood disease. If not for Alex, I never would have thought of it.
Today, the patient's family was wiping him down, and they accidentally fractured his bone. The fracture dislodged a blood clot, causing a pulmonary embolism. Chief Warren and Dr. Carter are both out today. Chief Hale told me to get him to the ICU.
The ECMO startup fee is $110,000. Plus, the daily running cost is at least $13,000. And other life support equipment.
Save him, whatever it costs. Just save him. I'll give all the money I've saved to the saints. Please, saints.
His case is very special. With chemo and radiation, the damage would be too great. And it is hard to tailor a plan.
Any ideas for the treatment plan? Any progress?
It is tough. Chemo and radiation are too high risk. We might as well just wait for a bone marrow transplant and hope for the best.
There are thousands nationwide waiting for a transplant, and a match for Paul Simmons is extremely rare waiting for a transplant. Is just waiting to die.
Right. Dr. Carter, take a look.
This is an oncology matter. Why ask Alex?
You think Alex doesn't know? His target area is better than mine.
What? That kid, he secretly showed off in oncology.
Bortezomib, thalidomide, lenalidomide, and others, plus long-acting corticosteroids.
So that is it. This is the answer we couldn't find.
What else is he hiding?
Wow. Every move he makes is that of a master. He really is our hospital star doctor.
Dr. Walker.
Dr. Carter. He has not only done a hysterectomy, but also helped oncology with a parotid mixed tumor resection. And on top of that, he repaired an incisional hernia.
Yeah, that is insane. Let me tell you, our Dr. Carter is now the role model for every doctor in the hospital.
Did you hear? Paul Simmons was discharged. His mom donated to a nearby temple, 800 grand.
800 grand.
That is 800 grand! If that had gone to RAR, how many patients could we have helped?
Come in. What is up?
We have a patient with stage 1 cervical cancer. I wanted your opinion on the surgery and whether to do chemo and radiation.
Let me see.
The cancer hasn't spread to other areas. We could have done a full hysterectomy, but she wants to have another child, so she is set on keeping her uterus. So I wanted your help on how to approach the surgery and the follow-up, chemo and radiation.
Dr. Carter is so handsome. He is really handsome.
Here is my plan. Do a Kung biopsy and also a pelvic lymph node dissection. Post-op, the TP regimen is first choice. Taxol and cisplatin. If the patient can afford it, add bevacizumab.
Okay. Dr. Carter, can I buy you dinner tonight to say thanks?
You are welcome.
Dr. Carter, one more thing.
Go on.
Dr. Bell from neurosurgery is apparently entering a competition. He is forming a surgical team, and he invited me. This competition, I think only people under 30 can enter. You signed up.
With all the surgeries lately, I completely forgot about the National Elite Scalpel Challenge.
I was planning to sign up.
So, for Opagin, do you have anyone in mind? If you don't, would you consider me?
So the requirement is to have people from different departments.
Not exactly, but the surgeries are random. One person can't possibly master all types of surgery. So, the team needs to cover neurosurgery, orthopedics, cardiology, pediatrics, and more. Whatever surgery you draw, the doctor from that department will lead.
They're not looking for a single all-rounder. They want a team that represents the future, an elite team.
Okay, you are in.
Great. I'll get going then.
Yes, I get to work with Dr. Carter. Finally!
Chief Warren.
I just got out of surgery and saw your message. You are entering the competition. What about your post-grad exams?
I'll make it. I can finish the exam in an hour. I'll make it.
All right. Since you've decided, I'll go ahead and sign you up.
Mike, about the competition. The hospital has discussed it, and we feel the team leader needs to be reconsidered.
Whoa, you are replacing me. Dean Hale, my skills are the best among the attendings. The best under 30. Who is more qualified than me?
Mike, your recent paper was excellent. Publish another side paper. And by next year, I'll recommend you for deputy chief.
Dean Hale, just tell me who it is, so I can put this to rest.
From the ER, Alex Carter. You've heard of him, right?
I see. Alex Carter again. He's got a big reputation. But he's just a guy in his 20s, qualified to be team leader.
Guys, Dean Hale is making Alex Carter the team leader. I am not playing second fiddle. I am out. So, are you guys still in?
If Mike's out, Bayview General has no shot at first place. I am out too.
I am out as well. What a waste of time.
Same here. I only trust Mike.
Seriously, isn't Alex Carter just the hospital's hype man? Isn't he just a pretty face to give our hospital a little publicity?
Exactly. He is only in his 20s, and he is supposed to do surgeries that even the experts can't. He can do that. Any medical student knows that is total BS. Him, team leader. He should just go home and sleep.
My team is made up of Bayview's top talent under 30, unless the dean doesn't want to win. Otherwise, he'll be begging me to lead again.
Hello, Dr. Bell. You need to get here now. Your patient with a stroke. He is in trouble.
What was he doing before this happened?
My dad and I told him a joke.
What a dutiful son, laughing or coughing. Can cause a pneumothorax. He probably has a pneumothorax. This might be more serious than I thought. Go get the pulmonologist.
Okay.
I am afraid it is more than a pneumothorax. We need to run more tests. It could be a tracheoesophageal fistula. His condition is this bad. Open surgery won't work. We need a minimally invasive procedure. Best is Da Vinci robotic surgery.
Your department has someone who can do Da Vinci.
No one in our department can. But I wonder if Dr. Carter can.
Alex Carter. Alex Carter again. Let's see. The guy who stole my spot. What he is made of. Find Alex Carter. The patient comes first.
Dr. Carter, from neurosurgery, a patient was just transferred. He has a pneumothorax and possibly a tracheoesophageal fistula. Could you please go take a look?
Okay. I'll go now.
He is just good looking. He doesn't look all that professional. And that thick dark hair. He is the last person I'd call a medical genius.
That is Dr. Carter for you. So smooth. So effortless.
What? What is with that insane speed? Just like that, in 10 seconds. He is done.
Atelectasis. When you put him on the ventilator, he was already unconscious.
Number, when I put him on non-invasive ventilation, he was still conscious. I diagnosed a pneumothorax.
You were wrong.
Impossible. His symptoms were classic for a pneumothorax.
Dr. Carter, are you suspecting the patient is in a diabetic hyperosmolar coma?
At the time, the patient wasn't fully unconscious.
I suspected he had tracheoesophageal fistula. Get a laryngoscopy and a CT scan.
Laryngoscopy is fine. No CT.
Why not?
It'll leave a record.
His first thought was that it would be used against him.
I am in charge of this patient now. I'll take full responsibility. Get him a CT.
Alex, can you do Da Vinci?
This surgery, I've already mastered it from a previous mission. With my master level interventional skills, I can handle it easily.
What is Da Vinci surgery?
A surgeon manually operates robotic arms for precise procedures. Da Vinci surgery is extremely precise. It is minimally invasive, and recovery is much faster. The success rate is also far higher than conventional surgery.
Is it expensive?
About 150 grand.
Doctor, we don't have that kind of money. We're already drowning in debt. We owe our relatives around 100 grand.
We could try a conventional open repair. About 5 to 10,000.
Really? Thank you. If my dad doesn't make it, I won't blame the hospital.
I am a doctor.
He is more ethical than I am.
Neil, take the family back to rest. We'll discuss other options.
Okay.
Alex, do you have any idea what you are doing? This is reckless.
Dean, I am confident.
No matter how steady a doctor's hands are, they can't match a robot. Besides, the patient's condition is critical. He needs the Da Vinci surgery. He heals faster and has a better recovery. That is his only chance. By doing this, you are taking on the surgical risk yourself.
It is okay, Dean. Trust me. I am really confident.
A surgery of this level. You can do it. No one will back you.
Then I'll find a way myself. Hello? Chief Warren.
Kid, what surgery are you doing now?
I want to do a tracheoesophageal fistula repair.
What? A level 4 surgery? You kid, did you buy a bulk pack of level 4 surgeries and come to my hospital just to show off? Alright, go ahead. Let me know the time. I'll come watch.
Thanks, Chief Warren. Let's prep for surgery.
Chief Warren, a level 4 surgery. He is actually backing this kid. He is insane.
Cool, let you in here. This is a level 4 surgery. You won't understand. Why are you here?
My colleagues weren't lying. My attending is really strict. It is a good thing I am with Dr. Carter. Sorry.
I asked her to be here. What is the problem?
Oh, Dr. Carter's student. That is great. It is good for young doctors to observe. They'll learn faster that way.
Yeah. Dr. Carter is so responsible. What a great mentor.
Let's start a surgery.
What a change, so fast. But Dr. Carter is so handsome. He is so respected.
Impressive.
This is the student I'll have. He never has complications. He has really opened our eyes. US old-timers.
The video of this surgery, send a copy to neurosurgery. I'll have my residents watch it 100 times. Let them see what it means to have skill and guts.
Dr. Carter, how is my dad?
Relax. Dr. Carter is a master. The surgery was a success.
That is great. Dr. Bell, thank you for taking care of my dad.
Get him a laryngoscopy and a CT scan.
Laryngoscopy is fine. No CT.
Why not?
It'll leave a record. I made a terrible mistake. In the end, I had to have Alex clean up my mess.
All hype. A resident doing a level 4 surgery. What about the OR protocols? Is this a joke?
Exactly. Level 4 surgery. You need at least 3 or 4 years of experience. Only a deputy chief can do that. Alex can do that. I don't buy it.
Mike, I heard you were in that surgery too. Spill the tea. Is Alex really as good as they say?
Mike's not even 30, and he is already a deputy chief. He has got a ton of research papers. He is a sure successor to Dr. David Strong. Who can beat him?
Everyone, I am not in Dr. Carter's league.
Patient violence! Prepare for a call!
Open Chief Linda Foster. A patient died despite our efforts. The husband stabbed Chief Foster in the heart.
Cardiac surgery. This is my field.
Chief Jennings. 3 stab wounds. Right heart near the pulmonary artery. Right lung. Left atrium. Blood loss. Over 2 liters. Blood. Won't stop.
Chief Jennings, let go. I'll take it.
Alex. It is no use. Tell my husband and kids. I love them so much.
What are you waiting for?
Let go. What are you doing with your bare hands?
The blood. It is stopped. His fingers are clearly blocking the pulmonary artery near the left heart, and all the tiny bleeding points. Is this really something a human can do?
Hurry up. An hour. Tops. There's no time to hesitate.
How is that possible? 3 wounds to the heart. How is that possible? To finish in an hour?
Chief Jennings, let me...
Are you kidding me?
Chief Jennings, hesitate. And Chief Storm will die.
He actually intimidated me. Jennings, let him. He might just pull it off. What a perfect mattress stitch. He finished it in the blink of an eye. So, this is the legendary Dr. Carter?
Check.
Inside the heart, there are hidden bleeding points. His blood pressure is dropping fast.
Keep the blood and fluids going. 400 cc of plasma. Methylprednisolone. Mannitol. Furosemide. Sodium bicarbonate. We're done.
41 minutes.
41 minutes. A 3.5-hour surgery. Finished in 41 minutes. It is like he is cheating. Dr. Carter, have you really never considered switching departments?
Speaking of which, I have something to say too. Neurosurgery will always welcome Dr. Carter.
Our pulmonary surgery, too.
Chief Jennings, was the surgery a success?
Can't you see? The star of the show now is Dr. Carter.
Dr. Carter, you are my god!
Chief Stone, you are exaggerating. I was just doing my job.
Congratulations, you've completed a cardiac rupture repair. Grade A plus 35 experience. Congratulations, 20 draws completed. New feature unlocked. Bayview General, number 1. Bayview City, number 1. Cloud State, number 1. UF, number 7. Global rank, 213.
System can unlock new features. A ranking system. Looks like I need to step up my surgical practice.
Chief, was the surgery a success? Is the patient out of danger now?
Not me. It was Dr. Carter here.
Dr. Carter, is the patient out of danger now?
The surgery was a success. He is in the ICU now.
Dr. Carter, regarding the recent high-profile medical dispute, what are your thoughts?
A scalpel can easily repair a torn heart. But when it tears a person's heart, repairing the trust between doctor and patient is not so easy. How long until he can be moved to a regular ward?
Chief Stone's recovery is amazing. He'll be off the vent and extubated tonight. And by tomorrow morning, he can be moved to a regular ward.
Still, a bit slow.
That tone of disappointment, what is that about? Being extubated in under 24 hours is already an incredible recovery rate, and he still thinks his surgery wasn't good enough.
Before the attacker was caught, he kept yelling, "A life for a life." The chance Chief Stone killed the patient is very slim. So what is the truth?
Dr. Lee, it is Alex Carter. I wanted to ask you about the Chief Stone incident. What happened?
Dr. Carter, why don't you come to Obgyn and see for yourself?
The patient's body is still here.
What body? His girlfriend is still alive.
Okay, I'll be right there.
The patient and her attacker were unmarried and pregnant. She already had heart failure and severe pregnancy, induced hypertension. We warned her family that she couldn't get pregnant. Otherwise, both mother and child could die. But they wouldn't listen. They still let her get pregnant. And knowing she could deliver early, they demanded an abortion at 21 weeks. There's only one successful case worldwide. So we performed the abortion, and the baby was stillborn.
I thought he was just a deranged, obsessed lover. But it seems I was completely wrong.
She is a poor thing. Her condition. Without ICU, she won't last more than a few days. After the stillbirth, her family abandoned her. When they came back, they brought a knife. Her condition is very grim. Her hospital bill is over $10,000 in the red. And her heart failure, after the termination, is still getting worse. Her lung infection is completely out of control. I am afraid she doesn't have long.
Wait, her right lung. Why is it smaller?
The infection is severe. She also has some atelectasis.
Guess this is my fate.
She has a strong will to live. Try to contact her parents.
I heard she found out she was adopted and ran away from home. She met her current boyfriend online and moved in with him.
They're still her parents.
Dr. Carter again. I always see him practicing in the OR. He is so dedicated.
No wonder Dr. Carter is such a great surgeon. It is all from his late-night hard work. Dr. Carter at night is just incredible.
One practice completed. Cardiac rupture repair proficiency. Plus 0.5%. Plus ranking updated. Master level cardiac rupture repair. Bayview General Hospital Rec. Bayview General Hospital. Number 1, Bayview City. Number 3, Cloud State. Number 16, United Federation. Number 132, Global. Number 1000 plus.
Just a 0.5% increase. And my state rank jumped 3 spots. My national rank jumped over 10 spots. Day 2. Time to check in.
Congratulations. Check-in complete at Bayview General Hospital. Your impact factor is 5.9. Reward obtained. Moderate bonus. Reward value multiplied by 5.9. You've obtained Master Level Cardiac Vascular Grafting.
Coronary stenosis. Scimitar syndrome. Why am I thinking of her? Is there something about Mia Moon that I am missing? Her condition. Scimitar syndrome. The heart failure. It wasn't the pregnancy. It was scimitar syndrome.
Dr. Carter, you are saying Mia Moon has scimitar syndrome.
Yes.
If you are right, and Mia Moon really has scimitar syndrome, then all her symptoms make sense. Too bad. The imaging isn't classic.
The heart doesn't always shift, right? Let's do a cardiac catheterization and angiogram. If there is an anomalous vessel, we can confirm it. Have you contacted the family?
Last night, I talked to Mia Moon. She gave me her adoptive parents' contact info. I reached out to them. They should be here tonight.
Any other questions?
I am just thinking, once we confirm it, for the patient and her family, is it really a good thing?
Why do you say that?
Mia Moon's condition, you know it. She is practically on her last legs. Once we confirm it, one surgery could save her life. But her condition, she is almost inoperable. This kind of pain might be worse than being hopeless. It is even harder. Dr. Carter, you can do any surgery, right? I wonder if this time there is a way to fix it.
It is Sunday. I am heading home to rest.
Figures. Dr. Carter's only human. He can't do every surgery.
Whatever. This surgery, I'll lead it.
Dr. Carter, you are my god.
Come in.
Dr. Carter, Mia Moon's parents are here. They've agreed to surgery. All day yesterday, we've been stabilizing her condition. At the earliest, we can operate tonight.
Mia Moon's condition is too fragile. She can't take any more trauma. Have the grafts ready.
Yes, Dr. Carter. With you on this surgery, her chances of survival have skyrocketed.
Alex, you were wrong this time. This surgery can't be done.
Can't be done? What do you mean? It can't be done.
The cardiac catheterization and angiogram did confirm the pulmonary vein shunt, and they confirmed the scimitar syndrome diagnosis. But during further testing, we found the patient's pulmonary vein diameter is only about 5 millimeters. Small vessels have always been a challenge in cardiac intervention. We didn't expect this. The patient's pulmonary vein has atrophied this much. This surgery can't be done.
I know. What I am planning to do is microvascular replacement.
You saw this coming?
Yes.
You were planning to do a microvascular replacement from the start?
Yes.
But that is microvascular replacement. At Bayview General, no one can do that. Why is Alex saying this so casually? I really don't get him. His composure. It is terrifying. Fine. I'll approve the surgery, but the surgery must be recorded, and you must allow cardiac surgeons and interventionalists to observe.
Agreed.
Dr. Carter, thank you.
Get some rest. You'll be fine when you wake up.
Okay.
Anesthesia complete.
Let's begin.
What are you looking at?
Chief Jennings, didn't you say that for the thoracotomy, you'd need at least 3 or 4 gauze pads? So why hasn't Dr. Carter even used one yet?
You are not Alex.
Congratulations, you've completed a scimitar syndrome microvascular replacement. Grade as skill level increased by 1%. 1 reward is ready to claim. Claim reward.
Claim.
Reward claimed, obtained advanced energy boost X1. Keeps you at peak performance, also permanently increases your energy cap slightly. Lasts for 3 days.
No need to sleep. No need to rest. As long as I have the stamina, I can keep working. This is really something. So, I am just a workhorse.
Chief Warren.
Just out of surgery. Come to my office.
Okay. Chief.
Come in. Come in. Have a seat. Alex, you don't have any research experience, right?
No.
Perfect. Chief Jennings has a few research projects. They're very promising. They can produce top-tier papers. I suggest you give it a try. Get used to the format.
Okay.
Once you are done, bring it to me anytime. I'll guide you myself.
Chief Warren thinks very highly of you. Make the most of this chance.
Don't feel any pressure at all. If it is too much, I have a few projects myself. They're sure to yield results.
Pressure, not a thing. I have so many papers I could write. I'll go with skeletal reconstruction. The data is more complete. Plus, the surgery is difficult. It is high impact.
Alex, you need to take care of yourself. I heard you. Haven't slept in 48 hours. Go home now. I am giving you 2 days off. Get some rest.
He looks nothing like he hasn't slept in 48 hours. I am starting to wonder, maybe the other doctors were just exaggerating.
Chief, I am done.
What? I told you to practice, but you have to take it seriously. What paper can you write in 2 days? Title, written, well, abstract, decent, keywords, format, all standard, models validate its ability to repair major bone defects. Done. So many words, and I read it so smoothly.
Chief.
Wait, hold on. Let me check again. You wrote this?
Yeah.
That surgery was just a month ago, and you wrote a paper like this?
2 days.
What do you mean, 2 days? 2 days of revisions. That is perfectly normal. Some papers take 2 or 3 weeks to revise.
Number. I wrote it in 2 days.
You are a true genius. With this quality, unless it is a top-tier journal, if it gets rejected, I'd say they're blind. Let's submit it directly to the UF Journal of Trauma and Orthopedics. Good.
Hey. Are you trying to get a perfect score? This is all data that hasn't been tested in 30 years. You are memorizing all of this.
Alex isn't kidding. He is really trying to get a perfect score. That is impossible. Since the medical licensing exam began, no one in the UF has ever scored a perfect 100. Alex is a brilliant doctor, but I doubt he'll be the exception.
Your score, I am not worried about that, but about the competition. Our hospital has given you the spot. The minimum team size is 4. Do you want me to help you fill the spots?
Dean Hale, before I leave, I'll send you the list.
You already have your team.
Almost.
Good. I'll be waiting to hear good news.
Okay.
For this competition, you don't have to pressure yourself to win. Your advantage is that you are only 24. You have 2 more chances. This time, just get familiar with the process. You can compete for ranking later. In your generation's terms, this year's competition is going to be a showdown of the gods. All the contestants are geniuses. Alright, I'll be going now.
Dean, take care. Anyone want to join the National Elite Scalpel Challenge? I am leading.
The National Elite Scalpel Challenge. It is the UF's top doctor competition. Oh my god, we get to compete.
Did you all forget? The hospital gave the team selection rights to Dr. Carter. He can pick whoever he wants.
In past competitions, we always had to go through a brutal selection process. Is this year's selection really this casual?
Alex, me, can I get some experience?
Okay.
Alex, me.
I hate this us. I am exactly 31. If Dr. Carter had just come a few years earlier, I could have gotten some credentials too.
Done. OB-GYN, Dr. Lee, E-Ear, Dr. Cloud. Attending Dr. Walker, Urology. Dr. Quinn, Reed. Hepatobiliary Surgery, Natalie. Nurses, Lucy Summers and Megan Young.
What is this? Where's Michael Bell and Sam Hill? All are under 30 geniuses. Why aren't any of them on here? Besides Emily Lee and May Cloud, the rest are just filling spots and so many female doctors. Are they just here for a girls' trip? This Alex is taking this way too lightly.
Dean, you wanted to see me?
Just look at this. The team Alex is taking to the competition. Who are these people?
Is this a beauty contest? And how did Frank Walker get in?
This is the competition. The National Elite Scalpel Challenge.
Emily Lee and May Cloud, I can let slide. But Quinn Reed and Natalie Grant, seriously, their skills, they're not fit for this competition at all.
What do you suggest? Alex is too full of himself. Does he think he can handle all the surgeries himself?
What can we do? Geniuses are like that. They have sky-high egos. Since you are grooming him, let him have his way. Let him be.
Right.
If in this competition he gets a setback, For him, it might not be a bad thing. It'll teach him there is always someone better. That there are limits. That way, Alex will go further.
The price is too high. A once in 3 years competition. Just to humble him.
Replace him. Let Michael Bell lead.
No way. If Michael Bell's team goes, how can they compete with Concordia and Westland's monsters? It is impossible to get a good ranking.
So there you go. Without Alex, our hospital's level can only compete locally in the South. Can't even qualify. Dean, after all these years, we finally have a genius. Just let him go for it. Once he is ready, the competition for him will be a piece of cake.
Let Alex prepare well. Let him have his fun. The next 2 competitions will be his real stage.
All right.
Congrats. Postmaster level acquired. Infratemporal fossa approach for zygomatic facial composite flat. Congrats. Postmaster level acquired. Transnasal H incision surgery. Congrats. Postmaster level acquired. Living donor nephrectomy. Master level renal tumor enucleation. Congrats. Postmaster level acquired pulmonary embolectomy.
I heard in River State, several hospitals this year have genius doctors leading them. Maybe River State Central won't even qualify for the state.
Concordia is the real deal. That is the real battlefield. Any team that makes it out of there is a true warrior.
What kind of team is this? Why are they all women? Bayview General Hospital team. Just eye candy. Wait, how come? The captain's spot is still empty.
Where is their captain? For a match this big, he is not so scared. He ran to the bathroom.
Emily, I remember last year's National Elite Scalpel Challenge. I was a team member. You were too. This year, I am the captain. And you are still a member. Where is your captain?
He just finished his post-grad exams. He is on his way.
You are kidding. Your team's captain from last year, Dr. Michael Bell, isn't here. Too bad. Like me, this year should be his last one before turning 30. Wait, last one before turning 30. Wait, that post-grad exam you mentioned. It wasn't Dr. Bell, was it? Then it is fine. At your hospital. Only Dr. Bell's skills can compare to mine.
Dr. Carter, you are here. How are the exams? With your skills, Dr. Carter. A simple exam is no problem.
Is Bayview out of doctors? They sent a college student?
In a way, Bayview's team this year is the strongest, well, the strongest in looks. Look, handsome guys, beautiful girls, so they're hoping to ride coattails to nationals. Just to get a spot and a title.
Bayview, just eye candy. But that Dr. Maycloud is really pretty. She is a catch. Our hospital is still short a few spots, right? Wait a bit. We could recruit her.
I like that one. The pear-shaped nurse.
Let's just focus on ourselves. Let them talk.
If it is a urology case, I'll lead. I'll show them what I am made of.
For hepatobiliary surgery, leave it to me.
I'll handle all human surgeries.
My God! So he is saying he'll do all the surgeries himself.
You all heard that, right? You all heard that, right? Our Dr. Carter, he is the ears all-rounder. From brain tumors to genital deformities, he can do it all. I am already ready to cheer you on. And you guys, just sit back and relax. He'll carry us.
First place, Bayview General Hospital. Perfect score, second place. Seaside City Fourth Hospital. 85 points. Third place.
Did I hear that right? An all-star lineup. Anatomy, diagnosis, surgery. All of that combined. And they didn't lose a single point. If Bayview General Hospital is just a pretty face, then what are we?
I heard during the competition that the new grad, Dr. Alex Carter, led them. They aced every event. That is insane.
Alex Carter? That name sounds familiar. Isn't he the star doctor from Bayview General? So, their perfect score makes sense now.
Dr. Carter, once you are out of state, you'll be up against Westland and Concordia. You should build a team with no weaknesses. And I specialize in heart surgery. I am applying to join your team.
I am a urologist. I am better than that female doctor on your team. I'll replace her.
I've done liver cancer resections. Also, I've handled severe acute pancreatitis cases, 4 cases. I saved 2. I am probably better than your Natalie. Much better.
You need to strengthen your team. Otherwise, your team won't be competitive at the national competition.
It seems everyone is impressed by Dr. Carter's skills. Let's see who he'll choose.
Dr. Carter, Nina and I can step down. This competition is once every 3 years. It is your first time. You are sure to do great.
We'll be rooting for you.
Then I'll step down too.
Why would you step down? We're a team. We're going to nationals together.
What do you mean? Not rebuilding? Alex Carter, you are way too arrogant. The nationals isn't a place for you to show off. If there is a single weak link, the whole team gets eliminated. Alex Carter.
Captain Carter.
We can all join your team at Bayview, General.
Let's go. We're going to nationals.
Dr. Carter, you make me feel so safe. Wait up, Dr. Carter.
Why call him Dr. Carter? Captain Carter, we're coming!
Today, we're celebrating Dr. Carter's exam success and his win at the National Elite Scalpel Challenge. So everyone, as long as it doesn't affect tomorrow's work, you can have a drink.
Dean, we can't call him Dr. Carter anymore. It is Deputy Chief Carter, now.
Alex, the true medical marvel. In just a year and a half, he is already being promoted. Deputy Chief of the ER. His papers, his research projects are countless. And let's not forget, he has performed countless medical miracles. Alex, what are your plans for the future?
Dean, I still want to stay in the AR. After that, I want to research the brainstem, spinal cord, liver segment, S7, and other areas.
After my promotion to Deputy Chief, the MedMaster System's mystery reward was indeed a brainstem danger zone surgery. In the past year, my rankings for most surgeries have already reached the top in the country and the top 3 worldwide. It is time to tackle the forbidden zones.
But those are all surgical forbidden zones. There are only a handful of surgeons in the country who can perform those surgeries.
If anyone else had said that, I'd have thought they were being arrogant. But since it is our Deputy Chief Carter, I believe that in the future, U.S. medical standards will lead the world by 20 years.
Vice Dean Warren is absolutely right. Dr. Carter in medicine, he is simply unbeatable. Whatever he says, he always delivers.
That is great. Who knows? In a few years, my position as Vice Dean might be taken over by Deputy Chief Carter. But as his mentor, I am so proud.
All right. Let's hear from Alex.
Looking back on this journey, I am very grateful for all your support. Learning is endless, and so is medicine. In the future, I'll keep working hard in all fields to help more patients.
Here's to you. Come on, cheers.
Dr. Carter. He is a national treasure. There is no surgery he can't do.
To be a healer, one must have a compassionate heart, treat patients as family, regardless of wealth or time. Devote oneself to saving lives, that is, a compassionate healer.